Good morning, everyone, and welcome to the Engaging Effectively with Refugee Communities Forum. I'm Jasusa Halaratna, Deputy Director of the Multicultural Health Communication Service, and I am your host for today. This forum is brought to you by the Multicultural Health Communication Service, New South Wales Refugee Health Service, Ministry of Health and Settlement Services International. Today, we celebrate World Refugee Day and recognize the strength of courage of individuals and families who have been forced to flee their home country and to find safety. Today is an important reminder of their resilience and ability to overcome extraordinarily unique challenges in their pursuit of freedom and community. This morning, we have key speakers who will highlight the importance of engaging effectively with refugee communities to promote access, equity, and preventative health care. And we are launching some very important resources for this purpose. I'm so pleased to introduce our speakers who have joined us here on set and also online. First, I'd like to introduce Liz Young, Director of Community Care and Priority Populations Health and Social Policy Branch of the Ministry of Health, to launch your resources. Liz, nice to see you.
Thanks, Jess. Lovely to be here.
And we have also with us Lisa Woodland, Director of the Multicultural Health Communication Service and Director of the Health Equity Promotion and Prevention Service of Southeastern Sydney Local Health District. Welcome, Lisa.
Thanks very much, Jess.
And we have, of course, with us Dr. Mitchell Smith, Director of the New South Wales Refugee Health Service. Thank you, Mitchell, for joining us today.
Thanks, Jess.
And we're also pleased to have online as our key speaker, Yamama Agua, General Manager of Newcomers Settlement and Integration from Settlement Services International Limited, or SSI, joining us online. Hello, Yamama.
Hello, Jess and everyone. Thank you. It's a pleasure to be here today.
Thank you. I would like to begin by acknowledging the traditional owners of the various lands of which we are all joining on from today. Lisa, Mitchell, Liz, and I are joining from the lands of the Camaragal people of the Eora Nation. We pay our respects to elders past and present and emerging, and extend that respect to Aboriginal colleagues and community members joining us in this forum. We would like to acknowledge also the community leaders and elders from multicultural groups and refugee communities who are joining us and represented in this session. Today, we are launching two very important resources: the Developing Health Resources for People from Refugee Backgrounds. This is a best practice guide for New South Wales Health, which we've really looking forward to launch and share with you, and the updated New South Wales Healthcare System Information Booklet in multiple languages. This has been updated and now in a few languages, and we'll hear all about it later. The event is presented, of course, by the partner organizations, as I mentioned before, and we have an exciting program with some videos and also to talk about the background of this project. We encourage you to share your comments and posts on the MHCS social posts and channels, and also New South Wales Health. And the hashtag is #RefugeeHealthWeek. So share that on your channels. To begin today, I would like now to introduce Lisa Woodland, Director of the New South Wales Multicultural Health Communication Service, and to talk about the background of the project and why we're all here today. Lisa.
Thank you very much, Jess, and thank you to Liz and Mitchell and Yamama for joining us today. I'm very pleased to be attending this forum to celebrate World Refugee Day and Refugee Health Week, and to launch resources to support engaging effectively with refugee communities. I'd also like to acknowledge the traditional custodians of the land and to pay my respects to people of migrant and refugee backgrounds who've come from all around the world to make Australia their home and to contribute to our multicultural society. The New South Wales Multicultural Health Communication Service is hosting this forum to coincide with the culmination of work we've undertaken through the Translated Health Resources for Refugee Communities project. The project is funded through the Refugee Health Flexible Funding Pool provided by Health and Social Policy Branch at the Ministry of Health, and seeks to address the New South Wales Refugee Health Plan priority of effective communication in people's preferred language. The project aims to increase health literacy of people from refugee and refugee-like backgrounds and support their access to healthcare. We know that the current practice for translation of health information often is a ground-up approach by health services, whereby they identify local needs in relation to health information and the languages, and then locally address these needs. And this approach has made a significant contribution to the existing health resources in languages spoken by refugees. However, there are many gaps in the resources available, and often the needs of small and emerging language groups haven't been addressed through this process. So through this project, we have translated a number of really important resources into 21 languages spoken by refugee communities across New South Wales, with a particular focus on maternal health, mental health, and accessing healthcare. These are available on the Multicultural Health Communication website publications page and a dedicated web page for the project. Our key project partners are the New South Wales Refugee Health Service and Settlement Services International, SSI. We have an advisory committee with key stakeholders, and I'd like to acknowledge those members of the advisory committee that are attending today's forum. The project has also established a community panel comprising SSI bilingual community workers from diverse cultural and linguistic backgrounds. And this panel plays a critical role in providing an extra level of review for translated materials to ensure that they are appropriate for community use. Today, we're very pleased to have Liz here to launch the Developing Health Resources for People from Refugee Backgrounds Best Practice Guide for New South Wales Health Staff. And this resource will guide New South Wales Health Services and programs in the planning, development, production, post-production and distribution phases of multilingual health information for refugee communities. We hope you find this best practice guide useful. In closing, I'd like to thank the Ministry of Health, in particular Health and Social Policy Branch, for their funding of the project, and the Strategic Communications and Engagement team for their ongoing support. I'd like to thank our project partners, New South Wales Refugee Health Service and SSI, for working side by side with us in this important work. I'd also like to thank the members of the advisory committee who have led the development of the resources, and the members of the community panel for their exceptional contributions. A special thank you to our project officer, Sylvia Giannoni, who's led the coordination of this initiative. And I'd like to recognise her outstanding work in the development of the Best Practice Guide. So a few more thank yous. I'd also like to thank the district and statewide multicultural health services and healthcare interpreter services who've also contributed to and shared in the development of these resources, and the team at Multicultural Health Communication Service for their great work and great energy around this project. And lastly, a thank you to all of you for joining us at this forum today. Thank you.
Thank you so much, Lisa. And it is the energy that we bring in knowing that we're able to develop resources that will help communities for their for their safety and well-being. It's really important. And if you have any questions, please put them on the Q&A or the chat, and we will try to get to those questions later on. And if we do not get to those questions, please send us your details on the chat and we will get back to you, and we'll make sure that we provide you all the resources available. Now it's my pleasure to introduce a video so that we'll watch it. It's a video by Rola Kalafawi Kandil, and she is a bilingual community educator of the New South Wales Refugee Health Service. And she shares how she values her role in helping improve the health and well-being of people from refugee backgrounds. And this just shows the partnership that we've had, and as Lisa has spoke about, the partnership that we've had in New South Wales Refugee Health Service in developing and updating resources. So let's watch this video now.
My name is Rola Kalafawi Kandil. I am a bilingual community educator with the New South Wales Refugee Health Service. Being from a refugee background myself and working for many years to assist refugees, I am always in awe of their resilience and determination to not only survive, but to thrive in their new life. My role is to provide crucial information on the healthcare system in Australia, equip families with the necessary knowledge of health-related issues, and to link them with various health service providers. This information is developed and provided in community languages and presented in environments that respect and value diversity and accommodate the beliefs and way of life of different refugee communities. Written resources include the New South Wales Healthcare System Information Booklet that has just been updated in 20 languages. It's always such a rewarding experience when I interact with refugee families and observe their remarkable progress. After a few months of settling in Australia, they're actively participating in making their health a priority and confidently navigating the services and feeling more resourceful.
Thank you very much, Rola, for sharing your experience with us. And we have a comment from the chat saying this is good morning from the New England Family Support Service of Anawan Land in New South Wales. Thank you for this wonderful presentation. Thank you for joining us today. I'd like now to introduce Dr. Mitchell Smith and our next speaker. And he is the director of the New South Wales Refugee Health Service, a key longtime partner and friend of MHCS, who will share with us about the importance of providing culturally appropriate and linguistically appropriate health services to refugee communities that provide relevant language support. Mitchell.
Thanks, Jess, and great to be here in Refugee Council of Australia's Refugee Week, and the theme is Finding Freedom, and it's also World Refugee Day, and the UN theme for World Refugee Day is Hope Away from Home, and I think those two themes meld together nicely. They're complementary and different, but certainly complementary. So New South Wales Refugee Health Service, as many of you know, support the health needs of newly arrived refugees and people of refugee-like backgrounds, particularly newly arrived refugees, but also people who've been here longer. We work mainly in Greater Western Sydney, but we also support local health districts across the state to support the way that they welcome and provide healthcare for people of refugee backgrounds, including asylum seekers who are living in our community. So it's very important that we provide adequate information to those individuals. Communication is key. I can't put it any better than Rula has just put it in her video. You don't really need me to speak, but she summed it up beautifully. As part of the helping address the needs of refugees, we do have an orientation program to the New South Wales health system, and that's what Rula was referring to there. And it dates back actually to 1987, so it's a very well-established program, and it was incorporated into the New South Wales Refugee Health Service when we were created in 1999. So next year it'll be 25-year celebration at this time, which we're looking forward to. So the New South Wales Healthcare System Information Booklet, and Rula has shown it to you there, but it was originally in 8 languages, and what's happened recently is that it's been updated based on feedback from a number of colleagues, from our bilingual community educators like Rula, who provide us with input, people from other organisations such as Settlement Services International and other agencies. So we incorporate that feedback into the booklet. We've also added some new information. So there's information now about consenting to treatment, some information about NDIS, and various other cancer screening programs that weren't previously in the booklet. Another part of very important means of introducing resources for people who have English as a second language is ensuring that the language that's used in those resources is simple enough for it to be well understood and then suitable for translation. So I'd like to mention an excellent online tool called the Shell editor, and this is Shell actually comes from the Sydney Health Literacy Lab. It's an acronym, if you like, of that lab, which is based at the University of Sydney. And it's a fantastic online tool, which is free. You can cut and paste anything that you write into that tool, and it will give you an estimate of the reading age, which means how understandable is it that the writing that you're doing in English. And this helps us to work on our writing to make it more readable, and it's also therefore more suitable for translation into other languages. And we've done that for this booklet. So as well as the new information and putting it through that readability tool, we've then gone on and had it translated, as Roland mentioned, into now 20 languages, including English. And some of those languages are from for the more minority groups who don't often have resources produced in their languages. So it's nice to see that examples such as Hazaragi, Kurdish Kurmanji, Swahili, and Tibetan, just as a few examples, and then 16 other or 15 other refugee languages. So these booklets are available in the printed version, and as I said, translated as well. They're also online, both on our website, Refugee Health Service, and also the Multicultural Health Communications website, I believe, Jess. Yeah. There are also a number of short videos that relate to the same information, and they're between 3 and 7 minutes long, and you can find these on our website again. And at the moment, these are in just 3 languages: Arabic, Dari, and Karen, Karen being a minority Burmese language. But the topics cover such things as Medicare card, how you use it when you first arrived, where to go if you're unwell, how to properly use an emergency department, because we need to use these resources wisely, I should say, calling an ambulance, basic knowledge needs to be known, dental clinics, cancer screening, interpreter services, and health services for children. So these are some of the topics that are covered by those videos, and you can look at the other topics online. So partnerships are always important in all of this work, as Jess has been highlighting, and I'd like to acknowledge our partnerships with, firstly, the Ministry of Health and the fantastic support that Liz and her team gives to not only New South Wales Refugee Health Service, but refugee health and multicultural health as a whole. So that's fantastic. And then also our partnership with colleagues from SSI and other NGOs. So Yamama, you're about to hear from, very important. And then the Multicultural Health Communication Service, Lisa, Jess, and others. So thank you very much.
Thank you very much, Mitchell. It's great to hear about the work that you do and also what the plans are for the future. And now we'd like to introduce a video testimonial by Mariam Boulos. She's a humanitarian settlement program orientation trainer of Settlement Services International, who shares the value of collaboration and co-designing developing effective language resources. Let's watch this.
I am Mariam Boulos. I have been working in the community service sector since 2013 as an Arabic interpreter and as a trainer at Settlement Service International. SSI is a non-profit organization that supports around 20,000 refugees every year as they begin to build new lives in Australia. Language is one of the biggest challenges new arrivals face in accessing health services. As an interpreter, I have seen many instances where individuals' health conditions have deteriorated because they haven't had access to interpreters, and there has been a misunderstanding about their diagnosis and treatment. In collaboration with the New South Wales Health Communication Service through the Translated Health Resources for Refugee Community project, I had the privilege to be part of the panel that reviewed the translation health resources to ensure they were appropriate and acceptable for refugees. Being involved in this project as someone who works closely with communities was rewarding because I was able to connect refugees with the health system.
A big thank you to Mariam for sharing us her story and her experience. It's also really good and inspiring to see health workers sharing their experiences and knowing that we're helping communities. I would like now to introduce our next speaker, very important, speaker now to talk about the important work of Settlement Services International. She's a big partner. The SSI is a big partner of our project, and we work very closely together, together with the Refugee Health Service. And she will talk about the current situation of refugees settling in New South Wales as a whole. Please welcome Ms. Yamama Agua, General Manager of Newcomers at SSI. Yamama, thank you.
Thank you very much, Jess. I would like also to acknowledge traditional custodians of the land on which we meet today. I'm joining from the Darug land and pay my respect to their elders past, present, and acknowledge any Indigenous people with us today. I would also like to acknowledge any refugee or refugee leaders with us today, since today is Refugee Day, World Refugee Day. It's a day, a special time to honor and appreciate the strength and resilience of refugees around the world and celebrate them. SSI is honored to work closely with the Multicultural Health Communication and Refugee Health Service on this project and to launch. We at SSI, we support around 20,000 refugees every year, where our goal is to support that search for freedom, peace, and happiness. We deliver a number of different programs and services to support the newcomers across the Eastern Seaboard, but the one that I'm going to speak to today is the Humanitarian Settlement Program, which supports refugees who come to Australia as permanent residents. This program supports, in New South Wales, we support about between 45,000 newly arrived refugees every year. The program is funded by the federal government, and we are contracted to provide the HSP in New South Wales and in Sydney Metro and parts of the northern part of regional New South Wales. As part of HSP, refugees receive support on arrival to Australia that includes airport pickup, short-term accommodation, community orientation, and health assessments. They are also assisted with making links to their community, a basic household goods package, and finding affordable long-term accommodation. At its heart, HSP supports the development of skills and knowledge that build the social and economic well-being of refugee and humanitarian entrants. Since the start of this financial year, SSI has welcomed 3,670 refugees or received referrals and provided initial settlement support for almost 2,000 individuals who arrived under the HSP. The top 5 countries of birth include Iraq, Afghanistan, Syria, Ukraine, and Myanmar. SSI case management model is an integral part of the HSP. It includes case managers, bilingual workers, volunteers, and the wider community, all of whom take great pride in delivering quality services to refugees and humanitarian entrants. HSP services enhance self-reliance and provide a whole-of-community approach to make sure that the refugees are really achieving the outcomes, the settlement outcomes. SSI has provided support to multicultural health communications by assisting in identifying refugee languages, priority health issues, and barriers. Within the diverse HSP workforce, many staff members are from refugee and migrant backgrounds themselves and are familiar with the challenges of settling in a new country and the needs of new arrivals. Through the project planning stages, SSI participated in co-design workshops and further provided advice on languages and cultural perspectives. Participating in the monthly advisory committees created a collaborative forum to share the ideas, advice, and feedback on the needs of newly arrived communities. In July 2022, SSI held an internal consultation with Sydney and regional-based HSP workers to identify gaps in health information and in the translated health materials currently available. SSI used our client database to identify top languages, which then supported the establishment of a community panel to review and provide feedback on translated health resources to ensure that resources were relevant, appropriate, and culturally responsive to refugee communities. It included the New South Wales Refugee Health Services information booklet. The nature of the resources topics relating to personal and mental health raised some challenges. It was crucial that we spoke with our translators ahead of the process to ensure that the necessary steps were taken to achieve cultural appropriateness across all resources. This would improve the overall readability of the documents and allow the client to connect with the outer communities in the way they intended to. 22 resources were reviewed in 6 different languages. SSI participated in a domestic and family violence care design workshop, supporting the development of a health awareness resource. As part of this partnership, SSI bilingual workers were there to provide cultural and language advice to the Multicultural Health Communication Service when needed. Out of the consultations, it was also recommended that other strategies are needed to complement the written translated resources, such as videos, audio content. As some people are not literate in their mother tongue, we should produce video, audio content. As an example, Assyrians, Chaldean, and more importantly, Afghan women who were banned from going to school when Taliban was first in power, and now they are adults. It's a sad world. We see this happening again this year, and we will have another generation of illiterate Afghan women if this continues. New South Wales Refugee Health Services information booklet is utilized as part of our orientation for HSP clients. This partnership has helped build our awareness of the languages of health. The community panel also had nothing but positive feedback about the experience. Multicultural health communications were very clear and understanding when working with us, very supportive and welcoming during the whole process. In achieving strong settlement outcomes, SSI recognizes the importance of working hand in hand with contributors from a wider settlement ecosystem. This partnership illustrates the shared value we can make when working collaboratively and transparently with a shared goal of improving the lives of others. I want to thank the Multicultural Health Communication Services and Refugee Health Services for their efforts in bringing this valuable partnership to fruition. It speaks to the collaboration and cooperation from all aspects of these projects. This will lay a great and strong foundation for successful settlement outcomes. Working together, we can foster a whole of community approach to achieving the best settlement outcomes for our clients and communities. Thank you very much.
Oh, thank you so much, Yamama. It's just a pleasure working with your team, for our teams, and the collaboration. And it takes a lot of work, calling up, but at the end of the day, it is about caring for the communities and caring for making sure that the resources are important, and that engagement that we've had with SSI and Refugee Health Service, the consultations really prove just how much gaps and how many gaps there are that we still need to fill. And thank you, Yamama, for that. And if there are any questions that you have for Yamama, for Mitchell, for Lisa, and for Liz, please put them on the chat and we'll try to get them to them in the question time after Liz speaks. But I'd like to now show you a video, and a video that we have of a friend of our team. It's Abula Agua. He is the Multicultural Program Officer of the African Communities at Western Sydney Local Health District, and he'll tell us all about how his project has effectively engaged communities through effective communication. And this is just timely for Refugee Health Week this year.
My name is Abula Agua. I am a Multicultural Health Program Officer at Western Sydney Local Health District. My role is to engage with African communities and provide evidence-based personal-centered health promotion program that are sensitive to language and cultures. One of the powerful and successful cultural appropriate engagement strategy with African community is to recognize and respect languages. It is not what we say or promote to the community, but how we say it and promote. Therefore, effective communication in community preferred language through a range of communication mediums such as verbal, written, multimedia is important. This improves access to appropriate and quality healthcare information and healthcare system. According to the feedback that I received from the African communities, the African Community Project has been successful in making a difference in lives of community by providing access to health information.
Thank you very much to Abula and to his team for all the great work and sharing the experience with us for World Refugee Day and Refugee Week. We also want to thank the Multicultural Health Service at Western Sydney Local Health District for their support with this video. And also, as Lisa mentioned, we want to thank all the multicultural health services across the local health districts, the health service interpreter services, because they're the key to helping support in language services to communities. And when Abula talked about it's not how you say it, it's not what you say, but how you say it. This is really important with the resource that we're launching today. It's developing effective use of the resources and how you can distribute it to communities. I'd like to introduce, it's my absolute pleasure to introduce our final speaker for this forum, Ms. Liz Yunk, Director of Community Care and Priority Populations of Health and Social Policy of the Ministry of Health, to share with us the ongoing work of the Health and Social Policy branch to ensure ongoing funding of resources and to provide how important work with refugee communities. Thank you, Liz, for joining us.
Thank you so much, Jess. And thank you, Lisa. Thank you, Mitchell and Yamama. Thank you so much for all the hard work of your teams in particular and their contributions to these amazing translated health resources for refugee communities and this project that we're celebrating today. And for bringing us together for this important forum on World Refugee Day. So I'm the Director of Community Care and Priority Populations in the Health and Social Policy branch. And my team is very privileged to be the policy lead for multicultural and refugee health in the ministry. And the ministry is really proud to have established the Refugee Health Flexible Fund over 21 to 23, which has supported healthcare for people from refugee backgrounds across New South Wales. So this fund has already supported 15 projects across the state, addressing local needs and including in regional areas, and including this project today that we're celebrating. The projects address the priorities in the Refugee Health Plan and include initiatives that focus on things such as oral health and mental health, care coordination and navigation, cancer screening, women's health, paediatrics and child health, and enhancement to health communication, which is the focus of our event today. So today we celebrate World Refugee Day, and our theme is Finding Freedom. And it reminds us of the resilience and strength demonstrated by refugees in their pursuit of a better life. It's also an opportunity to recognise the tremendous work of New South Wales Health and community organisations supporting the health of people who have resettled in New South Wales. So New South Wales Health launched the New South Wales Refugee Health Plan last year. New South Wales Health staff, in partnership with communities, continued their efforts to ensure access to timely, culturally responsive and trauma-informed healthcare services for people from refugee and asylum seeker backgrounds. And this has included new initiatives such as the Translated Health Resources for Refugee Communities project. So a huge congratulations to the New South Wales Multicultural Health Communications Service and partners, Refugee Health Service and SSI. I'd also like to thank and congratulate the staff across New South Wales Health for the important work you are doing to improve health services for people from refugee backgrounds. Together with communities and partners across government and non-government sectors, our work is helping refugees to find their freedom. It's now my great pleasure to officially launch the Developing Health Resources for People from Refugee Backgrounds Best Practice Guide for New South Wales Health staff and the updated New South Wales Healthcare System Information Booklet in multiple languages. I encourage you to use these resources in your work in engaging effectively with refugee communities. Thank you.
Thank you so much, Liz, and it's a pleasure that you were able to launch this. And you know, the projects that the Health and Social Policy Branch has provided with through the flexible grant, it really showcases that there are a lot of work. There's a lot of work to be done, and there's a lot of groups right now. This is just one of the projects that we're highlighting today. But there are so many organizations across the local health districts in New South Wales Health, and there's so many programs. And I think if you can visit the New South Wales Health website, and you'll find out about all those other projects. But we now have question time, and so this is opportunity for you out there listening in to ask your questions. But I'd like to ask about the Refugee Health Service, Mitchell, in terms of the work that we've done. We've launched the refugee plan last year. You also celebrated the nursing program, the refugee program last year. What's the next steps? What is it that we're seeing in the community that we should be, working towards?
Thanks, Jess. Well, I think what we're seeing is constant movement, as is always the case in the refugee space. You can never sit still because based on what's happening internationally, and we heard Yamama refer to the unfortunate situation in Afghanistan. That's just one example, but international geopolitics affects what we do here in Sydney, Australia, and so that's an important aspect. We're always seeing changing profiles of the refugee intake, and our government responds to requests from the United Nations HCR about which groups to bring in, and so that's always something that keeps us on our toes. And we're just starting to see a return to some refugees coming from the African continent, so that's not been a very familiar sort of background for recent years for us in New South Wales, but or at least in Sydney. So we're starting to see people from the Democratic Congo. So that's something that's changing. We're also very familiar with people with disabilities being resettled in New South Wales and Australia from refugee backgrounds, and that's been a welcome policy change with federal governments over the last 10 or so years. But it certainly throws up some challenges for us as service providers. And the other interesting aspect recently with the post-COVID backlog of refugee settlement or resettlement is that it would appear the government is providing visas to those with the most need, which is a good thing. But again, it's throwing up a number of challenges because we're seeing people with significantly complex health conditions being resettled in New South Wales. And that includes people with very complex chronic disease issues, disability, people from LGBTQI plus communities who are in double jeopardy, extra risks for persecution for them. So some really important priority groups resettling.
Thank you, Mitchell. We have a question here on the chat, a question and answer. Could you please tell us about some recent work with Ukrainian refugee communities? I'll pass this on to Yamama, this question, and also ask you, Mitchell. Yamama?
Sure. Can you hear me? Well, since last year, when the you know, with the Russian invasion on Ukraine, we've assisted over 1,000 people from Ukraine in New South Wales, and well, it's been very interesting, you know, a lot of challenges, but it's also a group that needed a lot of help. But there's a bit, because Ukrainian were here on different visa types, so we have been supporting them in the HSP program. But the support they receive is well, it's great that they have access to support on the visas they are on, which is initially tourist visas, and they changed. But we had a lot of challenges because some people had access to Medicare, some people didn't, and even the system and policy issues in terms of, even though that we knew that they were eligible, but how they were, you know, how the system accepted the Medicare or not. So we went through a lot of challenges in terms of their visa they on, but in general, they're settling quite well. And for people who, you know, transitioning from one visa to the other, they have access to different services. They've been connected to community. The Ukrainian community in New South Wales, in Australia in general, has been great to work with. They're very active, very organized, and they have an umbrella organization where they bring people together on a weekly basis to run activities. We're supporting people in with on-arrival accommodation, then long-term accommodation. We've seen many of them source employment and jobs, so actively looking for different employment and also education. But there's a lot of challenges in terms of the visa, whether they're staying or going, and what the future looks like. Thank you.
Thank you, Yamama. In terms of health services, Mitchell, that the question for the Ukrainian community.
Yes, well, initially the Ukrainians living, particularly in Sydney, where they were, they didn't have Medicare. They were on a temporary visa and didn't have Medicare. So we provided a GP clinic on a short-term basis to get them over that period where they were without Medicare, and while they went through the visa determination processes here with the federal government. So I think that was helpful. We also had a couple of very well-engaged bilingual community educators from the Ukrainian community who we trained up around the local healthcare system, who were excellent, and I think were a very useful resource. And in talking about engaging effectively with refugee communities, those two individuals allowed us to do that, I think, in a very efficient way. So thanks to them. And then translated documents like the ones we're talking about today, some of which were in Ukrainian and Russian language, which was deemed appropriate as well.
Thank you, Mitchell. We have a comment. One of our challenges is assessing and affording interpreter services in the Yazidi language in particular. We support many called families across our 8 funded programs. Interpreter services are essential so we can establish what kind of supports families need and link them with appropriate health services. We fund them interpreter services regardless, and this is important. However, for most family support services, engaging and funding the right interpreters remains a significant challenge. The health multicultural services will be really helpful for us, and we will certainly be accessing them. Lisa, do you want to comment on how important these services are in terms of multicultural resources?
I think one of our big priorities for particularly newly arrived refugee communities is to access healthcare and also access preventative health programs. And language services are just critical in that process. So written resources, translated resources can be used to support healthcare to communities, but also guide them to accessing the appropriate services. And of course, once people are connected to services, they need that interpreter support so that they can have full conversations with the health care providers. It's critical to people not only understanding those health conversations, but also feeling comfortable and supported and respected by our health services.
Thank you, Lisa. We have someone here, Randall, who's saying hello from the US, and he's joining us from the US. And thank you for joining us for this forum. Can you speak to what you see as the primary health needs you see in refugees, including children? And I'll pass it on to you, Liz, in terms of what the Health and Social Policy Branch sees and what plans are there.
Around
mental health and
mental
primary
health.
mental health for children and for refugees.
Yeah, sure. So look, this is obviously a huge priority in the refugee health plan, this area, mental health in particular. I think also Mitchell was talking about some of the priority populations that are coming in and very specific needs that are needed as well around disability support, communities from LGBTQI plus backgrounds. All of that comes with the need for a huge amount of coordination from a range of sectors. And some of that we just don't, we don't already have and needs to continue to be developed. So I think on that mental health aspect, the focus on what might be specific needs of communities coming in and being able to tailor locally, the responses is hugely important. In terms of child health and those kind of areas, obviously, look, so much that needs to be done in that area and be supported. The government, has taken a huge focus on things like the first 2,000 days, brighter beginnings, and all of those kind of programs also need to be able to be relevant to a wide range of communities. So we're trying to make sure, I guess, in our team that those kind of connections are made between initiatives and programs as well. But I think we can't underestimate the need to work in partnership with our partners like primary care. And we kind of look, to the Commonwealth as well about initiatives they're supporting through PHNs and others that help us do that work in partnership.
Yeah, thank you, Liz. We have a question here for Lisa or Mitchell from Holy Seal. What do you see as the future direction around availability of resources online in language? We saw a huge number of resources translated for COVID, but in other areas, we don't necessarily have resources available in language or available via videos spoken in language.
Would you like me to start?
Go ahead,
Thanks very much for that question, Holly. Look, I think that COVID-19, the pandemic, really taught the health system a lot about providing information to communities, but also the importance of engaging with communities so that that information was appropriate, was culturally nuanced, was respectful to their cultural practices, and so that the information was acceptable and able to be acted upon. So I think that COVID-19 has taught us many things, and it's a challenge now for New South Wales Health to respond to the range of other health issues that we know that are critical. So I would be advocating, liking to see that we are much more responsive in terms of providing information and providing that in a range of ways that is sort of understandable and acceptable, but also accessible to refugee communities. So that does include audio and visual resources alongside written resources. And really that's the purpose of our best practice guide, is really to give advice to people working in New South Wales Health about how they can tailor health information to be relevant and acceptable and meaningful for refugee communities. I hand over to you, Mitchell.
You've said it all, Lisa. I think I couldn't say it better.
Thank you, Mitchell. There's a question or a comment from Najim Choudhury. For someone who's passionate about working with refugees and migrants and cold communities and a health professional themselves, what do you recommend to get involved, especially if they keep getting rejected for jobs after interviews and being in the sector and being a refugee themselves?
Difficult question. And you know, I think one thing that perhaps I think Australia has a wonderful humanitarian resettlement program. I think something that we do less well as a nation is recognising the skills of people from overseas. I made a comment after seeing our latest batch of bilingual community educators that we trained through the New South Wales Refugee Health Service. There was about a dozen people in the room, Yolda there included. And I said afterwards, these people could run a small country. I mean, the amount of talent and intelligence in that room and experience was extraordinary. And I think we lose a lot of that in Australia through some of our stringent regulations around, including in the health sector, I might say, you know, in terms of health professionals from overseas. I think there's a lot of skill and talent there that we could use. I'm not sure if I'm answering your question, but I guess I'm coming at it from a different perspective. But yeah, it's difficult, and we have to acknowledge that there is sometimes overt and covert discrimination and racism, unfortunately, that exists, and so that impacts on people getting employment. We have to acknowledge that, and we have to confront it. So I don't know that I have an easy answer, but certainly acknowledge the challenges for newly arrived refugees to get employment at times.
Thank you, Mitchell. And Yamama, I'd like to pass that question to you. It is a difficult situation. Just thinking about your health, that's not the first thing you think about when you arrive. I mean, for refugees or for migrants. But Yamama, what would you like to say about this? The question about finding employment and how hard it is for people from refugee backgrounds.
It is challenging, as we know that refugees are very resilient, and they, when they come to Australia and they settle, they want to work, they want to contribute, they want to be part of our community. But the problem is that there are many barriers, including the language barriers, including the obviously skill recognition issues, but also there's the work experience, the local work experience that they don't have, and they need opportunities. Basically, we've been doing a lot of work about the lived experience and how we can embed some of those skills and experiences. I think we need the different all the agencies and departments to be open to provide an opportunity. So my advice would be for someone who's passionate and has the skills to start as a volunteer or to connect with support services or settlement services, and then be supported with a plan, whether to recognize their qualifications to do further studies or to find opportunities in an organization to support them with the first job, the applications, as simple as their resume, how to do the interview, where to look for work, and things like really relevant to their skills and experience. It is an issue for many refugees, and we have great programs, but there's a lot more that needs to be done.
Thank you, Yamama. There's a question or a comment here, tailored information needed not just for public health emergencies, but for all key health issues. This is from Ilse Benoit, and including chronic disease, maternal and child health. And we have a question from Abby Dawson. Are the healthcare booklet translations being produced in hard copy so people can request them? Yes, they're available. They're online. They're available in New South Wales Multicultural Health Communication Service website. They're also online available on the New South Wales Refugee Health Service website. And printed booklets are going to be out soon. So watch out for that, and we'll keep you posted. But here's a question from Kathy Preston. What does MHCS see as some of the most important factors in developing culturally appropriate resources targeting refugee communities?
Thanks very much, Kathy, for that question. I think central to creating resources is understanding that it's not just about the information that we as health services want to give people. That's often our starting point, and it starts from a really good place. We want to share that information. I think critical is understanding what the health information needs of refugee communities are, and to really think about that in relation to both co-design and health literacy. So by those things, I mean how we connect with communities to find out about their information needs, understand the best ways of presenting that information to them, and working with them to develop that information so that it is acceptable, accessible, and translated in a way that is meaningful for people. Mitchell's already mentioned health literacy in relation to the health literacy hub at Sydney University and the Shell program. And this is really about making sure that, again, we don't write resources that are meaningful to us at the level that we prefer to communicate, but really to think about what is, how do we present information that is understandable and, more importantly, useful for people so that they can access healthcare and preventative health programs. So those two key issues around making sure that we write things in the most appropriate ways through co-design, and ensuring that we're writing things at the appropriate reading age, and or considering whether we should be using audiovisual resources for communities as well.
Thank you, Lisa. We've had some really good comments. Thank you for this seminar. Excellent forum. So thank you for that, for those comments. An anonymous attendee has asked, may I ask how you support those who do not have literacy needed to understand the paperwork they need to provide to receive services, either paper-based or computer-based? I understand that there is interpreter services to use, but not everyone provides consent to share their information with strangers. I'll pass this on to the experts, Mitchell and Yamama. Mitchell?
Yeah, that can be challenging for people who are, anxious about engaging with authorities, or and that can include some asylum seekers that we deal with. Look, sometimes it's through volunteer groups or through migrant resource centres that assist, through the settlement services. There are some free interpreting programs available through Multicultural New South Wales, etc. But as you say, I think there's a reticence to use those amongst some in the community. That's a difficult barrier to get around as well. I think Yamama possibly might have some thoughts about how they assist in the translation area.
Thank you. Yamama?
Thank you. For us at SSI, the majority of our workforce are bilingual. So our case managers, many staff do speak a different language, and we try as much as possible to assign a case manager or someone who speaks the language to any families. If we don't, we do use our internal staff for interpreting and translating, obviously not for health issues, because they're not interpreters or accredited interpreters, and we use basically interpreting translation services. However, so for most refugees who come through the humanitarian program, they do have access to case managers, they have access to support services, but there's so many people out there who come on different visa types who don't necessarily have access to any settlement support services, and they would be struggling if there's no appropriate interpreters or access at different services. So we know if we want to take our clients to register with the schools or with any other service, we have our bilingual staff going with them. But that would not be the case for someone who comes under a family stream visa, for example. So we need really all services to be equipped, able to respond to any newcomer needs if they come for services.
Thank you so much, Yamama. And thank you to all the speakers. And thank you for you joining us. You know, we've run out of time. It's 1 minute to go. We have lots of comments coming in, and we appreciate your time joining us here today for World Refugee Day and also for Refugee Week. We all play an important role in keeping people from refugee backgrounds healthy and enhancing their ability to access much needed health resources. So we hope that you are able to use these resources and access them so that you're able to work effectively in engaging with refugee communities. And that concludes our forum for today. Thank you to all our speakers, Liz, Lisa, Mitchell, and Yamama, and to, of course, those testimonial videos that we received from Abula, from Rola, and Mariam. They were fantastic videos, and those resources will be shared online on our Facebook, New South Wales Health, and MHCS channels. So please use them and share with them far and wide. And we want to say that we want to thank everyone who's joined us. There's a few people to thank. We thank our partners, Refugee Health Service, Settlement Services International, and Ministry of Health. We thank you for your great support and collaboration. We also thank, of course, we've mentioned Rola, Mariam, and Abula for all your great work for the communities and your teams that continue to do the work with cold and refugee communities, and for sharing that inspiring story, because I feel like we continue to do the work and we want to do that. Thank you for trusting us and attending this forum. We have these resources to share. Again, hashtag Refugee Week 2023. I'd like to thank the people. This doesn't happen just like this. There's a lot of preparation. So a big thank you to the Ministry of Health, the Multicultural Health Communication Service team, amazing. And also I'd like to thank the Strategic Communications and Engagement team to ensuring that we are able to develop and also bring this forum to you today. And that brings our event to a close. It's a wonderful forum. It's a great day to recognize and remember World Refugee Day. And please do the work. Thank you. Lead with kindness. And we hope that you've enjoyed this forum, and a wonderful thank you to the outstanding work that you've done and continue to do for communities. I'm Jasusa Halaratna. We thank you and have a great day.